This meeting to order. Thank you all for joining us here in the Nat U Hill Room and on Teams online. Thank you so much for being with us. This is the Monroe County Substance Use Disorder Awareness Commission. Today is May 17th. It's noon and we are in the historic Nat U Hill meeting room at the Monroe County Courthouse. We have a quorum today and we're going to launch right into some business here. We're going to start with the Educational Summit Committee report. I know that body met yesterday. I don't think there's an official report to give, but I will ask those that were in that meeting. I think there's 3 of you here today. Can you relay kind of your takeaways from that meeting as kind of what the advances are in planning for this summit that's going to take place on September 5th?
Well, we are moving forward with what's going on, and we've been in touch with the folks at Convention Center that do AV and those kinds of things. They've given us a preliminary budget of about $17,000. Looks like we're doing well on lining up all of our speakers and getting all those little things figured out. So at this point, one of the big things that has to be done is to get a conference organizer. And we do not have to put out an RFP or an RFQ for that because it is probably under $50,000. So we should be good to go on that kind of thing. What did I leave out? Sorry.
Any additional points from yesterday's meeting?
I think we're working on just getting the details from the speakers in terms of what equipment they need for everything, if there's going to be audio that's required, that sort of thing. We have most of the speakers. I think there was like one breakout group that we're still like working on, and Erica has some leads on the topic for that. And so, yeah, things are going well. I know that there was discussion about the honorarium, which is something we're going to discuss today. But yeah, we're all getting really excited as it moves forward.
Good.
There is one thing I forgot. Shelley Yoder has agreed to be the keynote speaker.
Yes.
Good.
And she sits on the state substance use, I forget what it's officially called, but she's on the state committee for some of these issues. And she actually was one of the co-organizers of the very first summit.
That's right. She's such a great asset to have. Melanie, do you have any additional thoughts or recollections of progress?
I think that everything has been covered.
Okay.
I think so.
Good. We are also, I don't know if we touched too much on this in your updates, but we're also going to be approaching individuals in the community to help us underwrite this event. This is an expensive event that we're holding for the broader community, indeed the region. So if your organization would like to be a sponsor for this event, you can get in touch with me, or you can get in touch with Erica Oliphant. It's probably a good time to really praise the Monroe County Prosecutor, Erica Oliphant, for her dedicated work to planning this summit. She is the chair of the summit subcommittee for this body. So we are really encouraged by the work that she's doing. I think now I don't see, I do see Molly Turner King online. If you all would pull up, you should have a draft of a SUDAC recommendation for an honorarium. Ms. Turner King, is your voice sufficiently healed enough to talk?
I think so. Can you hear me?
If not, you could send us a message in chat.
TSD, can you promote me?
Hello, Molly. You are promoted, but I don't think they can hear you in the courthouse.
My mic is on.
Molly, for us, we cannot hear you.
I'll let them know.
Trouble yesterday with a Teams meeting and somebody else did too in that same meeting. So.
Hopping back on worked for you?
Huh?
Hopping off and hopping back on, maybe? No.
All right, well, while TSD works on our technical services, oh, yes, so Molly is working with TSD on the audio. So let me tee this up until Molly or Ms. Turner King can get on here. This SUDAC recommendation you have before you, I will ask for a motion to vote on this today. This deals with the honorarium amount that we will pay to an event planning organization to help do marketing prior to. Oops, hold on one second.
Not this one.
Do we have?
For the speakers.
That is for the speakers, yes.
Yeah, and
Excuse me.
I don't know that we,
Sorry, I've got my.
this was not what I thought we agreed to in the planning thing. I thought we agreed to this for the panelists, not for the main speakers.
Let's
Yep.
get Molly online, and we can amend this as a body. That's certainly possible.
Can you hear me now?
Yes, we can.
Okay. So yesterday I had the opportunity to speak with Miss Oliphant, and she was asking if we needed to draft agreement for services for each of the speakers who are going to present at the Recovery Summit. In looking at it, I don't think we need an agreement for services because technically we're not paying them for their services. Instead, the idea is that you're going to provide them an honorarium. However, if you're providing an honorarium, the auditor's office needs to still have some type of document that would, in essence, support the payment to the vendors, or in this case, the speakers. So this morning, I drafted a recommendation for SUDAC to consider to look to, in essence, recommend to the Board of Commissioners, since SUDAC is an advisory board to the commissioners, the payment of an honorarium to speakers. And so I have the document open on my computer currently, so if there are any suggested edits or changes, I'm happy to make it as we go.
And Ms. Turner King, we also have a printed version in front of everyone too, so we can look at it. I want to go back to a comment that was made here at this table about one of the clauses here for guest speaker or presenter. Was that not the, is there any further conversation on that?
I thought at one of our previous planning meetings, we had said that this is what we would offer the panelists, but that we would try to offer the keynote and the, what's the other level of speaker? I don't.
Like presenters.
What would be their typical honorarium. And so that may or may not be $100. I mean, there may be people that come in and say, no, I don't want this at all. The other thing is that we said that for the panelists, they would be allowed to attend the full day event at no charge. And so I don't know if that should be included in this also.
I think for the speakers, it was reimbursing them for travel and hotel room if they're from out of town. Whereas the other people, it would be like $100 payment for their time.
I thought that for people come in from out of town, that was in addition to, yeah.
I just wanted to check in with Ms. Turner King. Can you hear this discussion?
I can.
Okay, good.
I also thought that it was in $100 in addition to the travel and hotel. Yes.
But was that just for the panelists, or did that include the two main presenters and the keynote?
I am failing to recall
Wasn't
a
at
dollar
yesterday's
amount for the
meeting.
keynote speaker. That would be more, but that would make sense to me.
Okay, so I'm hearing two things. Number one, we need to distinguish between an honorarium for speaking and travel costs. And number two, we need to distinguish between who is a keynote speaker and who is a presenter.
And a panelist. Because because the presenter and the
Keynote versus
keynote will be
panelist.
in front of the whole group. The panelists will be in those breakout, is my understanding.
Okay.
And there's a different level, I think, of preparation and stuff involved. I don't know for sure, but
How many panelists do we look at having?
I think we have a couple different panels going. I know one of them was of people with lived experience, and I know we have two secured, and I think there was like a few that Nick needed to identify. I think there was going to maybe be there may be 4 or 5 for just that. And was there another panel, Melanie? I should have brought those notes.
Yes.
And Nick is on his way upstairs. He's in the building, so he can speak to his panelists as well.
I had a panel that was going to be 4 or 5 folks.
And I think also that, I think for one of the panels, there was somebody was going to be like a moderator. So
I believe Nick.
Nick, do you need chocolate?
For those of you watching on Teams, there's singing coming from down the hallway, and lo and behold, singer.
I think you're a tenor. Is that right, Nick?
Vaguely. I'm working on it. Hello.
All right, so Ms. Turner King, I want to bring the conversation back to you. This question about honorarium versus travel costs, is that germane to what you were trying to get at with this resolution?
I think we can include it in the resolution.
Okay, so we can take a motion from the floor to include that in the resolution.
If you
And-
give me about 30 seconds, I can share my screen because I've edited the resolution.
Excellent. As Commissioner Githens adjusts the screens in Nat U Hill, if we can, they were all adjusted for the commissioners meeting on Wednesday, it looks like. So we are looking at an honorarium here.
Okay.
And the conversation was that the resolution covers a speaking fee, an honorarium of $100, but this resolution does not talk about travel costs that would also be reimbursed for folks needing hotel.
Yeah, we definitely need that, especially if the people from ACDC are coming, right? So they're going to be flying from other states.
And can you define what ACDC stands for?
ACDC is the I can't remember what it's actually called, but it's the basically
Alliance for Collaborative Drug Checking.
Alliance for Collaborative Drug Checking, and they're a great group. They also do like Remedy Alliance, which is the place that basically got us naloxone to be over the counter. I mean, they're a multifaceted group, and they're figuring out right now who they want to send. I asked them to send Yarlix and Taylor. Taylor works at CRA, and I think that'd be more closer to what we wanted to look at. And so they're going to internally figure out who to send, and they're going to let me know hopefully by today. I said by the end of the week. I imagine it might take till Monday till they tell me, but then we'll know for sure.
Ms. Turner King is sharing their screen here.
And I can't see what you can see on the screen. So is it the Word version of the
It is the
recommendation?
Word version. Ms. Turner King, could you zoom in a couple clicks?
Okay, tell me when to stop because I can't see the.
Right?
I can just see you guys.
Keep going, keep going, keep going, keep going, and that's about good, I think.
Okay, so what I did was to summarize the conversation, I changed the clauses after the now therefore so that SUDAC members would be recommending for keynote speakers and presenters who are presenting to all attendees of the Recovery Summit that the individual be reimbursed for travel expenses in addition to receiving an honorarium in the amount of, and I've left it blank so that you could tell me what to put there. And then for individuals who serve as a panelist who will be presenting to smaller groups of attendees at the summit, they will receive the honorarium of $100. All keynote speakers, presenters, and panelists will be offered the opportunity to attend the full the full summit at no cost. And then, oops. And then the last bit of the paragraph explains that in both instances, this one-time payment is provided for their as a token of appreciation.
Excellent.
Did you put anything about travel?
Hold
in
on.
there?
Mr. Voiles has a question. Just speak.
Couple questions. Is the $100 just for the people that are like anybody that's going up on the panel, Or is this for the people that are coming from flying from out of town and doing all that? Okay, that's different for them. Okay. Oh,
Buddy.
anybody?
I think I've just tried to distinguish it in the resolution, sorry, as keynote speakers and keynote speakers and presenters versus panelist.
And then for out of town, I think, and none of our panelists are out of town, but I think some of our speakers are out of town, and then we would be reimbursing them for their plane tickets and their hotel room.
Are we paying or reimbursing? There's a big.
It was my reimbursing. They were supposed to keep their invoices, and then we would reimburse. I do think Eric has mentioned that if somebody couldn't pay up front, that she could work something out.
It would work with them.
If they can't pay up front, I'll put it up and I'll receive the.
It's cleaner if it goes through Erica because of
Great,
county.
sounds great.
Yeah.
Let's do it.
But on your number one there, you've got for keynote speakers and presenters who are presenting blah, 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 will receive an honorarium in the amount of, and you've got blank.
Correct, because I didn't know if you wanted me to also put $100 for that, or if there's a difference for the keynote and presenters.
We should
So
definitely-
can we put in like language that says that the, for keynote speakers and, oh, hold on.
There's a-
There we go, okay. And item number one, can we conclude that sentence with a contractual agreement or a
Whatever.
negotiated agreement or
Whatever.
Penny's
what
coming up with
their-
language?
Their rate is like, so whatever, yeah.
It's a variable rate.
Yeah,
What is their standard rate?
yeah.
We also want to make a cap though and not let someone hit us with.
Yeah,
a
you could probably do a not to exceed amount and then put a cap on it.
I don't know that we
Does-
want to do that right now.
Because they'll go for the cap.
Yeah. So can we put in language that's not as specific, Ms. Turner King, something about the amount is variable or the amount is,
How about
And voted upon by us.
Cutting it off at the point where it says an honorarium.
Honorarium.
yeah, there,
Yeah, it's an honorarium. That's perfect. Yeah.
or
so, yeah, take out amount, take out in the, and put a period after honorarium.
It would be cool if we paid all the lived experience.
but I think for the auditor's purpose, we'll have to establish what the amount will be. So
We can do that individually with them. Because if we've got somebody who normally speaks for $100 as opposed to somebody who normally speaks it for 5,000, we don't want to.
That's right. That's right. And we don't want to get into like either if they only want blue M&Ms in their hotel room.
Oh, God. Jesus. Who do we have here? I mean, I think we can probably figure out really quick.
I just added some language. How about in addition to receiving an honorarium in the amount to be individually determined based on the keynote speaker's presenter's circumstances?
I'm looking at Commissioner Githens because this resolution will go to the Board of Commissioners. How do you feel about this language?
I think it'll help pass if we have some idea before it goes before the Board of Commissioners what those amounts are going to be. I mean, I can ask the person I reached out to, that I recruited to be one of the presenters.
I'll do the same.
And you've got one presenter and
We have for HRSO, we have Deborah Stanley, who's coming from,
but as a presenter or as a panelist.
as a panelist. I only have one presenter, two or three presenters at the top. There's a group of them. I don't know who's going.
Okay.
There'll be one or two of them, and they could probably split. I'm sure they'd probably do it for. Just let me ask them. I'll come back.
Okay. We have amended the current resolution pretty substantially. Is there any additional conversation on the amendments to this resolution before we ask for a motion for the amendments? Hearing none, could I have a motion to adopt the amendments on the screen?
So moved.
We have a motion
Second.
and a second for the notes. Nick Boyle, second. Commissioner Githens. Is there any additional conversation on the motion to accept the amendments that you see on your screen for this resolution? Hearing none, all those in favor of the amendments that you see on your screen, please say aye.
Aye.
All those opposed? The ayes have it unanimously. So now we go back to the underlying resolution that is now amended. And again, this resolution recommends, contingent on approval by the Monroe County Board of Commissioners, that individuals who attend the Monroe County Recovery Summit, and we include those 3 bullet point languages. So we are recommending to the Board of Commissioners to take this action. Is there a motion to make this recommendation to the Board of Commissioners?
Yeah.
We have a motion from Nick Voiles,
I will second.
and we have a second. Is there any additional conversation on the motion before us here in the Nat U Hill room? Is there any public comment? I see we do have some people online today. Seeing none, all those in favor of this resolution for the 2024 Monroe County Recovery Summit Speaker Honorarium, please say aye.
Aye.
All those opposed? The ayes have it unanimously.
And
All right.
I will work with Mr. Iverson and Melanie to get signatures, and then I can put it on the commissioner's agenda thereafter.
Excellent. Look how fast county government works. All right. So we can now not only be able to have conversations about offering honorariums, but we now have a helpful distinction between keynote speaker and presenter and panelist. All right. The next thing I will mention, we're going back to our agenda. We're still on 2A, the Educational Summit. I believe this is going to be how it's going to be until September, probably. We're going to spend a lion's share on the Educational Summit, and that's okay. Prior to this meeting, I had worked with Ms. Oliphant, Prosecutor Oliphant, on a scope of work for a marketing firm or marketing company to help us market this event. That includes marketing prior to the event, marketing during the event, and then some time afterwards to help us kind of do a review of how the event went and start planning for the 2025 summit. The names of individual organizations that have been recommended by Commissioner Githens, by myself, and other community members now have been passed along to the commissioner's representative, Angie Purdy. Also, that scope of work document that Prosecutor Oliphant worked on with me has now been passed along to Ms. Purdy. So the commissioner's office will be reaching out to these different marketing firms and requesting them to reach back with their own thoughts about if they are able to do this work and that sort of thing. There will be a deadline by which organizations will need to get in touch with the commissioner's office, at which time, if more than one organization applies, there will be a process by which we look at those different organizations. The commissioners will then vote on a contract with the organization that is chosen, and the council will appropriate the dollars for the work to be done. So we are moving forward on providing marketing assistance for this event. Any questions on that? Because I just dumped a ton of information on you.
It's September 5th, right?
Yes, in fact, on the bottom of the agenda that is online, there's a beautiful purple graphic that I think our health department drafted.
Specifically, Ms. Locke, I think.
Excellent job. And you can find this save the date not only on the bottom of the SUDAC agendas going back almost to February, I think, but also on the SUDAC Facebook page. I talk about it at every council meeting. I'm pretty sure the commissioners are talking about it. So it's getting out there. And of course, one of the benefits of having a marketing firm on deck is that they can help us start getting invitations out. So that's going to be kind of the next step. So it's really exciting. And again, huge thanks to Erica Oliphant, your Monroe County prosecutor, for heading up this effort. Before we move away from the Educational Summit, is there any other topics that we need to cover to-dos, anxieties.
Do we happen to know, like, when the deadline for getting that marketing firm is gonna end up being, if there are multiples, or like how soon we should expect that?
I suggested a deadline of June 1st. However, that came off the top of my head without talking to anybody. So the sooner the better. Because at this point, the more we tarry, the more is put on Erica's plate. I mean, Prosecutor Oliphant's plate, and I don't think that's good for her department or this event. So I think that if we reach out to people
ASAP.
today or Monday, that gives them a week, 2 weeks to review a very short list and get materials to the commissioner's office. And then if there's more than one entity, I think we can review those very quickly. And again, I'm looking to Commissioner Githens.
We move pretty quickly because we meet pretty much every week, so.
The slowest part will be the council appropriating the dollars, because we only meet twice a month.
Well, you have to advertise it before that even, so.
That's exactly right. So it could be a hot minute. That's a technical term, by the way. All right, let's move away from the summit and go to our next committee report, which is the Opioid Settlement Committee. We have been meeting regularly. We had a meeting, was it last week? Was it this week? I can't even keep track.
I need to write up what our overall recommendations are so that I can present them to the council and to the commissioners. But I just learned this morning that we've got some more money coming in.
Oh, fantastic.
Email from today, hot off the press.
Ooh, breaking news.
Yes, that says beginning next week, the Office of the Attorney General will distribute your share of the Publicis settlement. And in addition, you're receiving payments from AmerisourceBergen, now known as Cencora, and Cardinal Health. These will be prepayments, and that is in addition to what is already coming through. Some of this will be early, but that total is an additional $100,000.
That's fantastic.
Yeah, I could use that.
So, you know, I've been saying for a while that there were other entities we were going to get settlement money from, so now it's starting to actually come in, which is good.
Excellent. Excellent. So even more funding coming into the opioid settlement. Are there any other points on the opioid settlement committee? I know Nick and Melanie, you were in those meetings as well. Anything that you'd like to present to the public today?
Yeah, so I talked to some people locally, you know, and I think people just misunderstood and they didn't understand, you know, sometimes I think people just don't believe it. They're just people that don't get things, you know, and you have to explain to them. So I explained to a couple people that, like, what was going on with it, and you know, that the money was out there and what it was for and all this, and so hopefully we should have some new applications soon. You know, I know I'm hoping well, I can't say I'm hoping certain people apply. I'm hoping certain people get for it. I think it's really key to remember that the stuff that's restricted is meant for harm reduction, and we should think about that. But no, it's going good. That was sorry, bad joke. I think it's not a joke, but
I'll laugh.
yeah. I think the group is really good, and I think that, like, the RFP was one of those things that when you look at, you're so happy that you get to look at it just from a writing grant's point of view. Simple, direct, that's it. You know, we're gonna know these people. It's not like we're getting some startup from Yucatán pulling in to do their version of harm reduction. These are known entities usually, and I think that, like, I just really like the way that that was laid out. It's something that anybody who pretty much, like, is wanting to be involved in this can be involved if they want to, you know, which is a lot of times hard for us to write these huge complex grants that require all this stuff that really doesn't do anything to describe who we are or what we're doing. It's just for them to check their bureaucracy, you know. So kudos to the commissioners and for everyone for putting that RFP out that way. It was really done well, and as soon as I showed it to people, they were like, oh, you know, it's not some complex 8-page grant. Wow. So hopefully we should be getting some really neat applications soon.
So we do need to get things sort of approved by both the Board of Commissioners and the council in terms of the overall things. And that's why I said I need to get something written up. That was just kind of laid out for me on Wednesday. So.
Cool. Good.
I can help with that if you would like it. Huge kudos goes to our auditors department. They're the ones that are tracking this money and also are the ones that got the application online. So if you're hearing what Mr. Voiles is saying about how there's opportunity out there for folks to fund their work in substance use recovery, or whatever you're doing, as long as you're in this field of substance use disorder, there is right now an application for you to fill out. If you go to co.monroe.in.us or simply Google or whatever your search engine is, Monroe County Government, there is a white box in the middle called Very Important News. You click on Very Important News, and lo and behold, there's an opioid settlement funding link. You click on that link, and that's the application. It's documents talking about what organizations are eligible and what organizations aren't, as well as important deadlines. And the way that we've set this up is that there's going to be rolling deadlines. So the current deadline to submit your application is June 30th. Another round will begin immediately after that. And of course, the reason we're doing that is because of what Commissioner Githens just talked about. Additional settlement dollars are coming through the courts, and they're starting to be dispersed down to local governments. So additional monies will be available, and we want to make sure that we're not holding on to it, that we're getting it right back out into the community to help people where it matters the most.
Well said. And thank you, Penny, and all the other guys for really making this a possibility.
Doing it.
There's a lot of places that are not doing so well with their opioid money. It is really nice that this is getting sent to people who can use it. So.
All right. Any other statements, questions, comments on the opioid settlement?
I just wanted to say that for the Exhibit E of approved uses for the opioid settlement money, you can go to nextlevelrecovery.in.gov/recovery/settlement on Next Level Recovery Indiana, and it has a lot of information also about opioid settlement money, things like the John Hopkins Bloomberg School of Public Health 5 guiding principles, spending the money to save lives, using evidence to guide the spending, investing in youth prevention, focus on racial equity, and developing a fair and transparent process for deciding where to spend those funds, which I think we're doing, but I just wanted to point that as a reference to anybody that's interested in the money.
Yeah, there's also just looking up the actual opioid bill, what it was intended for. There's a huge thing that it specifically says that there is some stuff that this money was thought of when they created. So, harm reduction.
Right. I'm trying to think. You'll note that if you do have questions on the actual application, there are 2 emails listed for Ms. Woodruff and Ms. Gregory in our auditor's department, our auditor's office. So any questions you have, reach out to them. Of course, any one of us here on the SUDAC body can pretty adroitly, I think, answer questions as well. I would reference you to the health department first. I think they've got a lot of good information. So, of course, does Commissioner Githens and our community partner, Nick Boyle. So, all right, let's move on from the opioid settlement and let's talk about IRACs. This has been on our agenda repeatedly, and do we have an update?
There's someone here, don't we?
Yes. Jamie Whitaker of the IRACs program at the state level has met with all kinds of different members in our justice system, and except for one. He hopes to do that virtually, and we are still waiting for a meeting with the city of Bloomington. But otherwise, he's very optimistic that we will get this up and running soon.
Any questions or comments on IRACs? My question would be, what are the next steps? Is it an RCO? Is it another meeting with Mr. Whitaker? Is it what?
He is planning to talk with the folks at New Leaf, New Life, and with Heather Rodriguez sometime next week. And
okay,
I don't have a handle quite on that part, but yeah.
It'd be nice to know what's going on with it at some point.
So it sounds like we'll get a more concrete update next month.
Hopefully.
Okay. Any other thoughts or questions on this topic? Seeing none, I wanted to pivot to some work that we've been doing in the Sheriff's Department. In the council, we have been working with Sheriff Marte and his team on some justice initiatives that he had outlined in a 10-point plan late last year, or early last year, excuse me. And just this year, we've been able to fund 3 different positions inside the jail. These will be Sheriff's Department employees. One is a reentry specialist. One is a 3rd qualified mental health professional. There are already 2 in the building, in the jail. And a 3rd is a substance use disorder specialist that will be housed inside the jail. This person has not been hired yet. They are currently doing interviews for this position. And I'm not sure what stage they're. Well, I just saw someone in a uniform walk by. Maybe they can. All right. Yeah. So those 3 positions are through the medical contract for the jail. And we worked with, the council worked with Sheriff Marte on those things. So in addition to the things that we're doing out in the community, such as the opioid settlement, the educational summit, and IRACs, we are also doing things inside the jail. We think this problem is so big that we need to be working with every single partner we have access to. And of course, you know, we have representative from the courts here as well. So I wanted to put this on there because I know there's probably some questions and I wanted to be transparent with this. What questions do you have? What comments do you have? Nick, do you?
Waiting for other questions. I thought it looked like somebody might have other questions. I was just waiting. Nobody? Has any questions at all? Who exactly is the reentry specialist? Do they have lived experience? Have they ever been locked up?
I do not know who.
How then could they possibly help with reentry?
So my understanding is that the intent of this position was to work with individuals as they are coming into the jail. So day 1, and they'll work with them until the Board of Judges releases them from jail. So it's an internal position. So they'll work with them on issues that are based on an individual's, you know, own lived experiences to ensure that we're trying to stop this loop of recidivism.
I guess when it says reentry specialist, that says, to me, that says someone who's reentering society. Like when I think of reentry, so this is, okay, it's just named.
This is inside the jail, working with people who we know. Because again, I think, my memory serves me correct, and it's not always accurate, but I think the average stay inside our jail is about 20 days. Penny Githens is shaking her head no. 7 days.
Also, we have to take.
What your impression is, Mr. Moore?
I don't know.
I have no idea.
So I guess my question is, so will this reentry specialist do anything for folks once they leave jail? Because I feel like that would be a key thing, that there needs to be help once they leave.
I agree. And I don't, you know, if other people want to talk about this, I'm happy to, but my impression, the way I think about this is when an individual is arrested, then they go before the Board of Judges. The Board of Judges makes a decision, and sometimes that means an individual goes into the jail. Then this reentry specialist starts working with that individual right away up until the point in which a judge says, okay, you can leave. Average is 7 days, right? So 7 days later. Then the IRACs program, particularly the Community Recovery Organization, then that's when they start doing that takeover, where they're working with individuals outside into the community. Again, Penny Githens is shaking her head no.
I'm not going to say anything publicly. I just can't.
So here's what I asked. Can I speak?
I'm also interested in what Senator Sullivan has to say.
Yeah. I guess my thing is like finding out who this is, and then community partners meeting with them to share what those resources is. I would hope that the reentry specialist would then be connecting people to those agencies that work outside in the community. And I think the JRACS things like something completely separate that would be integrated differently. I think they would all work in conjunction together, but I think that's like a whole separate thing.
I think what's happened here is somebody's named this reentry and they have no idea what they're talking about. Hear me out. When commonly in our world you talk about reentry, I'm sure this is all of you. Tell me if any of you think I'm wrong. When reentry specialist comes out, that's when they're reentering society. Is that correct? And I think somehow this just got named wrong. So like having somebody in the jail to liaise with, right? It's like like what IRACS is going to become. You know what I mean?
Mm-hmm.
Is great if they're not a sheriff, if they're not a police officer. Whether the sheriff hires them or not or whatever is not necessarily the thing, but like having that person there would be great. It'd be clutch, you know, especially that in like collusion with these three things. I see what you said. Like it'd be clutch, man. If like I could flip out and talk somewhere, someone was there to work with me to get my stuff back so when I get out, or help me contact my mother who's in Evansville and I don't know her address or stuff like that. I just think whoever put reentry, it just got mislabeled. And if it was labeled something like incarceration advocate or something like that, it might, people would think of it in a different way and you'd be like, oh, okay, I get it. Because that's what, as soon as you spoke to me about it, like I get what you're saying. I get why it's important. That's something that I could get with, you know. The three things up there, the qualified mental health professionals, always wonderful. We can't have enough of those, you know that.
Yeah.
And a substance use specialist, and so that's why a reentry person would have to be someone who has lived experience. But I think as long as they're taking a new leaf, new life, like that should be our out. Like we should funnel every reentry we can and fill robust services with them. That's their niche, that's their place, that's great. You know what I mean? And substance use, I would hope to dear God with what we know about our world now, that it should be somebody who's lived experience. I think the sheriff would probably even agree with that. Maybe he's looking in that area. It seems to me like we need to know more. Is that right? Like this is just like the entry level stuff.
Yeah. I wanted to introduce these topics onto this agenda today.
Would you check on that for us?
I would love to do that.
Mr. Iverson.
Get to know the people that are being hired. Like, would you just talk with Sheriff Marte about connecting with them to start kind of educating them? And I don't know, this person could be from the community and know about all the organizations that are out there, but to make sure that they're aware of like those processes and stuff.
Let's try to get them before.
Well, and also, these are positions that exist right now, as far as we know, into perpetuity. So people will come and go. So having an opportunity to have these conversations will ensure that as we move forward, we can, take into account the advice that we're hearing here.
That's awesome. Just if you could get clear on that, the next time we meet, we can know where to go from there. I'm with you on all that. Then we'll know how to help. You know what I mean?
Yeah.
That way we can all do something that's actually functionally wonderful. You know what I mean? It's actually all of us working together.
And that's exactly why I wanted to put this on the agenda, so that we could all work together, because, it's important.
There's plenty of work for all of us. We just need to learn how to work together.
Exactly right. That's exactly right. And I'm hearing what you're saying too, and I'm thinking, boy, how exciting would it be to have each one of these individuals come to this body and talk about what their work is, and then hear from all of us about how, the title of your job doesn't really define what you're doing, or whatever, right? Or how can you work with Centerstone more? How can you work with, the courts more? How can you work, et cetera, et cetera, et cetera?
Could you imagine having a person when you're in jail? So that's his first offense, right? It's his first time. Goes to jail, he comes out, he's gonna have a year on probation. Could you imagine if someone could actually be like, look, dude, when you're on probation, this ain't gonna float. This is gonna float. If you do this, you're cool. If you don't do that, you know what I mean? Get a job, get that stuff, and just talk to them and work it through. It would be game changing if someone would have explained to me, from a peer point of view, this is how you get done with freaking probation. You know what I mean? It would be game changing. It'd work for you and your people better, and work for them, I mean, it's just an idea I just had sitting here thinking about this. I thought, why aren't we looking at that as well? I think all of those, demystifying these things, that probation's gonna swoop down and suck your soul out the back of your head. No, you can work through and get through these things. So, sorry. I know I'm going off a tangent there, but. So
Would you like to say anything?
Yes. With the average stay in jail, honestly, I'm not sure what somebody can do in 7 days with the average stay in jail. I just,
nothing. Nothing.
I wasn't going to say that, but
I will.
that's my belief is that nothing, I mean, even in 20 days,
Even 6 months, what
I
could
would
you
find
do?
it hard to
Yeah.
believe. But if my guess is this reentry individual, whoever it is, would be working with somebody who's looking at months, if not years in jail, and then when their sentence is done or whatever, they're helping them integrate back into society. Ashley's with me on the CARES board. We just literally this week went through all the grant applications, scored them, and we have several programs there that we're going to be funding that will be helping with the reentry process as well. So I didn't want to, you must have seen my face or something, because I'm just thinking that 7 and 20 days,
That's good
there
feedback.
ain't no way.
We need to have these conversations. This is important to talk about.
And I think a lot of us, like, that have been through the system and work in the system know. I think we know more than most and should be looked at more. You know, it's like, you're talking about someone coming in there, and mostly those 7-dayers, you know who those
I see
are.
it.
That's the first time DUI, that's my U kids, that's this or that. Those of us that live here come in for our first actual jail time, it's probably about 6 months.
And I'll tell you that the ones that we get into the reentry court program are typically coming from DOC and have already completed what's called purposeful incarceration. And they're already through the reentry process where that's concerned. We're just helping them get back into society, getting them more treatment if needed, housing, so on and so forth. So, yeah.
All right, so this is a really great conversation. We have another important voice to add in here. Ms. Molly Turner King, who has a lot of experience in this field, would like to say something.
I just wanted to provide some clarifying information about these 3 positions. These 3 positions are provided for by a third amendment to the Advanced Correctional Health Contract. So I'm not sure if Advanced Correctional is doing the hiring or if the sheriff's office is doing the hiring. And in the contract amendment, it does not refer to any position as a reentry. It refers to a discharge planner, and Advanced Correctional provided a very specific job description on what that individual would be doing, which includes being responsible for discharge planning for detainees receiving mental health, coordinating medication and medical needs upon release, coordinating with community resources. And I'm happy to send this job description that was provided to Advanced Correctional to the members of SUDAC.
Can you say that again
That
louder?
would be very much appreciated.
Excellent.
I second that.
Molly, do you know if any of these positions, you say like they might be from Advanced Correctional and they might be from the jail? I mean, to me, that's kind of do any of them have lived experience? Are we looking at that area for people?
I don't know the answer to that. I will say what the contract says is Advanced Correctional Health will coordinate on site
Gotcha.
qualified mental health providers for 120 hours and 40 hours. And I don't know if it's not clear in the contract if by coordinate they mean they will provide a person or if they will just work with the sheriff's office to hire it. So I don't know how the hiring processes worked, and I don't know if the individuals who have accepted the positions have lived experience.
Awesome. Thank you so much.
The information we got in an update last council meeting, again, is reflected in the agenda today, that the 2 individuals at the top have been hired and that substance use disorder specialist was being interviewed. Ms. Molly Turner King, as always, thank you for your clarifications. Those are always very helpful. So
We should have had her speak first.
Yeah.
I'm not afraid to make mistakes. Again, it's important to have this conversation out here. And I'm hearing now 2 things. Not only will the job descriptions be sent to your email, I even am thinking that that's being done now, but also that we will get these individuals an invitation to come and speak to this body so that you all can have access to those folks,
Awesome.
know who they are, and that sort of thing. Ms. Turner King, did you still want to talk? You have your hand raised? Oh, the hand has gone down. Excellent. Are there any other conversations about this topic, either here in that U Hill room or online? All right. This agenda item will stay on the agenda as we can talk about the job descriptions next time and maybe even have an individual come to talk to us. All right, let's pivot to our health department's community health assessments ongoing. What updates do we need to hear about?
I think the most important stuff is we're continuing to do focus groups. We have some scheduled through the end of May. So if you have a group that's interested in doing a focus group, reach out to myself or Kathy ASAP, because we are going to try and compile all of that information by the middle of June, so one of our partners can meet their deadlines. We also have the community needs assessment survey that's live. So I've sent, I pass it around here in the Nat U Hill room. I don't think that the link is posted on our social media or any of our partner social media, but it should be soon. And I think that you've got the paper copy up there. So the thing that's in the email itself, there's like an image that looks a little bit prettier and it has a QR code on it.
I'll do the pretty one.
It gives you more information. It says that the deadline for that one is 11:59 on some date that I don't remember.
Sharing it right now.
June the 15th, it says here.
June, okay, perfect. Yeah, and so for any community member, you can fill out the survey. You can click that QR code. You can go to the link that is listed underneath the QR code. The survey is live right now. So please, we want to hear from you. We don't want to have it skewed to the people that just have a lot of time to fill it out. Any community members.
Would there be any objection to me making copies of this and putting it in the lobby or the waiting room with the child support? Because we have a lot of people from the community that come in there and they may not spend a lot of time online, but they're sitting there waiting, and this may be something that would speak to them, because they do have opinions, but they're not heard a lot of times because they're sometimes feel ignored.
We would really appreciate that. If you want to put it in any, if you need a printout copy, you can send me an email. I can send you also an email with that image, make it shareable, put it wherever you've got folks that you're talking to. Yeah, I think that's all for that. You might also be getting a mass email from Kathy or our Send Blaster, so feel free to forward that on anywhere. You might get 5, I don't know. But I think that's my big update for it.
I got it at 2 different email addresses.
I got it as well, so yes.
So are you going to be dispersing this throughout town, or?
That is the plan. We're trying to just hit people through emails, get printed copies of that, put it on posters, wherever throughout.
Okay, cool.
This is the Monroe County Community Needs Assessment. So all of those CHIP groups that we talk about. So the focus groups, those all inform what will become the CHIP groups, so that we're working on improving health and wellness in Monroe County.
Yeah, we had a really good time with them last year.
Do you have any of these available printed off yet? Because my printer doesn't work very well, so, or beyond just this one copy. Okay, cool, thanks.
Yeah, we just print them here, like, isn't there county,
We can
use some
yeah,
county
I can
dollars
print
to
them
print
for you.
some.
Yes.
I will also mention, if you go to the Monroe County Health Department's website, it is robust and always helpful. Also, follow them on Facebook. They are constantly posting really valuable things. So the Monroe County Health Department is a great resource. Use it and take this survey.
I have one last thing before we close, but I can wait till the very end.
Okay. Yeah, we're going to do member announcements in just a second. We're going to pivot to the minutes for March 15th. We have those here in the Nat U Hill room. Thank you, Melanie, for printing these out and passing them around. Once you've had a chance to review them, I'll entertain a motion to adopt them.
I move that we approve the minutes from March 15th, 2024.
We have a motion and a second. Any conversation? Does the public want to say anything about the minutes? Online, seeing none. All right. All those in favor of adopting the March 15th minutes, please say aye.
Aye.
All those opposed? The ayes have it unanimously. Again, thank you, Melanie, for doing those. That's really, really helpful. All right, we are going to go around the horn now for member announcements before we adjourn. And Nick, I'm going to go this way. You get the final word, okay?
Love that.
I have nothing to report,
You have nothing to report.
Unless you want to go caving.
Not want to get stuck
You don't get
upside
Not
down
if you're good.
in a small crevasse.
That's half the fun.
All right, from our courts, what do we have?
Just that I mentioned earlier about the CARES board, and we did our scoring Tuesday. We're working on the matrix and getting the allocations out, and I want to do it a lot quicker this year than we have in the past 2 or 3 years because it's been a pain. I'm sorry. Get them out and get the funds out sooner rather than later. So.
And our specialty courts are doing well. They're
Specialty
coming along.
courts are doing well. We did institute, I did get the grant money that I spoke about privately a few weeks
Yes,
ago.
Good.
They are getting, all their drug screens through the week are being free of charge.
Good, good, good.
Unless
That's
it goes for
amazing.
confirmation, then we have to charge them. But right now it is, the response in the courts the day we announced it was, there was quite a bit of relief from a lot of the participants. And my hope is, I just literally last Friday handed in our 4 additional grant proposals for 2025. So I'm hoping this continues into 2025, 2026, going forward at this point in time.
All right,
That's
you heard it
huge.
here first. SUDAC, brand new grant money coming into our specialty courts, brand new grant money coming into our opioid settlement. Man, this is a news-breaking body here. Sounds good.
Congratulations.
Sounds good. That's really
huge
exciting.
for
Huge.
individuals.
I agree. That is huge. I
No
agree.
more pain for pee. Love it.
Yes. And my hope is that at some point in time, the saliva test that we do on the weekends will be free as well if we move forward. So.
Excellent,
Yes.
excellent. That is really good news. All right, Commissioner Githens, the pressure's on. Any
Well-
good news coming out of the Board of Commissioners?
This is, I wanted to announce that Wear Orange Day in memory of victims of gun violence will be celebrated on Friday, June the 7th this year.
Okay. Excellent. Any updates at all? No happy news? No sad news? All right. Senator Stone, what do we got?
I don't know that it's an update, but I did want to just remind people that Centerstone has a mobile crisis unit, and that anyone that is in crisis with mental health, substance use disorder, suicidal, anything like that, they can call our number, which is 877-463-6512. And they're available 24/7, 365. And I think this is something that our community has really needed, and it's being utilized right now. And I think it could be used even more if people are more aware of this. So please spread the word.
And
Talk to you about that.
are those teams still fully staffed?
Yes.
Oh, okay, so people are waiting for you to call.
Yeah, they are.
Does the police dispatch have that information? Because I know the police
believe
get
that
called all the time.
I believe that they do.
Okay.
988 is aware of that. However, 988 isn't working to full capacity the way that we want it to. And also, when people are calling, it's based on their area code, not literally where they're located at. So sometimes they get sent to wrong places. So I've been sharing this hotline number so that people are aware that they can call this directly.
Health Department.
Fill out that survey. I am also really excited that something that came out of our CHIP groups is our SOFR-CAT, our Suicide and Overdose Fatality Review Community Action Team. And so working with, other community members to continue that work to increase access to Narcan, get more of our resources for more targeted folks. So that's in the process as well. But please fill out that survey because that's going to help guide us in the next 3 years. So. That's all.
Fantastic. Fill out the survey. All right. As promised, final word.
We are almost done with our building. We had
Wait, which building?
the Indiana Recovery Alliance's new building is almost done. There will be a soft opening, which all of us and a couple other people will come. We'll do the big public opening later, but all of you, when it happens, you get an invite from us for the SUDAC board members to come and check out the building before anybody else. See our vehicle and everything. So I'll make sure that you all get a hold of that soon, probably by the end of June. So we're going to be starting to move out now pretty soon, and And hopefully in another year or so, we'll start phase 2. The second thing I wanted to highlight is, I don't know if you guys have been paying attention to the news lately or not, but I've heard that in Indiana, for the first time since our opioid crisis, our numbers are down.
The numbers for fatal overdoses,
Fatal
right?
overdoses. Harm reduction works. Harm reduction interventions not only work, there's fast evidence proving all of this. For all those people that didn't understand it or denied it, the proof is in the pudding. We are a saturation state, so we try to saturate. All of us have done this. You know, you all work in the field, you know. And so this is a huge thing. The CDC came out preliminary numbers, but the preliminary numbers are usually only off a very small amount. The scary part is methamphetamine and other ones were up, right? This is a whole other thing we're gonna have to deal with soon. The meth is now way different. When checked, we're finding psychedelics in the meth. Like, this is crazy. You know, I mean, this is like into the craziest realm of crazy. And this is one of the other things about drug checking. It's like, we have no idea to identify and stop. But I'm not banging that stick right now. I just wanted to say that, like, in Indiana, we lowered overdoses. So that's all that matters. That's us putting Narcan out there. That's us walking those fields every day. That's us making sure our people, when they leave probation, have Narcan. That's all of us doing the job that needs to be done to make sure that that happens. So I just wanted to bring that to light, that's happening.
We will have Narcan training at the summit.
Yeah, that's amazing. We have to, yeah.
Is there a place where, for Indiana, they are collecting data on basically Narcan, like reversal numbers? Just because, like, I've heard about the overdose death rate being lowered, but it's but then it'd be good to see like that reflected.
So yes, actually, the hard part about all that is, like, we have always collected robust. The health department and I collect a lot of data about reversals. So we have a huge, you know, it's hard to say to people don't want that data because it's not done by a coroner or stuff like that. So we collect it, and SSPs all over the country collect it. For us, our reversals are up. They always go up every year as more naloxone is out there, as more people understand how to use it. If you want, I'll put something together and show you our number, like how it's increased for us in Monroe County. And that's by people coming to us and saying, I used your Narcan to reverse an overdose. A lot of times during an overdose, people are not calling 911. They're too scared. They might have a warrant. They don't understand Aaron's Law, anything. So, like, you have to understand that 90% of the overdoses are happening outside of first responders. Those are the people we talk to. Those are the people we have data from. You know, there's federal stuff going on to start getting those to count, but that's not through yet. As soon as it does get through, then we'll be able to say our story the way it should look, which is overdose reversals went like this, deaths went like this. Also, more naloxone goes into the community, deaths go down. Stuff like cleaner syringes, all of these harm reduction interventions, along with the people who are implementing them, are making this difference. You know, and I mean, like, there's a lot of places that are not seeing downwards. You know what I mean? Like, Indiana's definitely striving to be a saturation state, which is so. But yes, I will actually, I'll put it together for you and show you what our stuff does, or what the IRA does as far as reversals for this year.
All right. My update is we are approaching budget season. So as for the departments here, as you're creating your budgets, try and think about ways to get substance use disorder prevention in there, right? How do we make sure that we're budgeting our values? For those of you who aren't counting budgets, bend my ear, bend the other council members' ears. How can we more effectively fund our values here? So that's my pitch. I think, all right, good. We have no further updates. We are going to next meet on June 21st. Put that on your calendars. We will send out emails, Ms. Molly Turner King will, to remind you of that. And again, we need 6 people for these meetings. It's important. And we'll see you in June. This meeting is adjourned.
Thank you.
Thank you.
So do you have cards
That
or
grant
anything
stuff
for
is so
that crisis?
exciting. Thank you.